Hi, I'm Dani Gasparini, and welcome to this segment of Penn Voice. I am joined today by Dr. Shruti Dhapodkar, who is the manager for the Emergency Preparedness Program, San Mateo County, and also Betty Ortiz-Gallardo, who is a therapist within the San Mateo County Behavioral Health and Recovery Systems. Thank you both for joining me.
Thank you.
Doctor, I'd like to start with you first. You are with the Emergency Preparedness, you're actually the manager of the Emergency Preparedness Program within the San Mateo County Health System. So what's it like, sort of in a day in the life of your position?
So my role as Emergency Preparedness Manager for the County of San Mateo Health Systems is basically to make sure that the health system and its response for any emergencies fits into the overall county's emergency response planning and response itself. So as you can imagine, we do a lot of planning, make sure plans are put in place, they're vetted by all the different agencies, putting in different protocols in place, testing the protocols, making sure all the stakeholders come together and talk about the protocols and see if they actually fit or don't fit.
And you sort of lay in wait for that day or that act of God or emergency system.
Actually, we don't. We practice a lot. And train a lot, because that is the only thing that's shown to have better outcomes. Mm-hmm. So that is something that the health system takes pride in, is the constant and ongoing training that we do and the exercising we do with drills.
And Betty, you are within the Behavioral Health and Recovery Services of San Mateo County. You are a therapist.
Yes.
So tell us a little bit about what your day in life is like in that position.
Well, I supervise the team of social workers, and our team is particularly in charge of the clients that are out of county, so they're placed out of county. And we go out and support our clients, and the reason why we're doing this is because most of our clients are conserved. So that means that they're gravely disabled. So a lot of our clients are being discharged by the psychiatric hospitals, our San Mateo Hospital, and other hospitals in the Bay Area. And what we do is try to place them in different placements. And we follow them, and we try to support them as best we can. So that's what we do on a daily basis.
So we're going to use the Napa County and Sonoma fires as an example of how your two departments sort of fit in and go to work. So it's very recent that we all experienced, I think, the Napa and Sonoma County fires. So Shruti, how did your department then deploy and begin to support that community?
So we actually received a word from the region saying that Sonoma and Napa needed help, and there are requests that go out through the mutual aid program. Mm-hmm. So we were requested from the health department itself several things: environmental health response, behavioral health response, animal control. Our nurses were on standby, the public health nurses, and so we actually ended up deploying over 27 people.
And how early in the emergency are you typically notified? As soon as it begins, or once that community's health services has decided what they actually need?
It's usually as soon as that operational area, for Napa, it'd be Napa, Sonoma, it'd be Sonoma. As soon as they have exhausted their resources, they go up to the regional level, and the region puts out call for help, basically, from every county that's in the region.
So you were saying that we deployed 27 professionals from our San Mateo County health system to Napa, which means, I believe, Betty, you were one of those 27.
Yes.
So you were deployed as a therapist to obviously speak with victims?
Yes.
So tell us a little bit about that experience.
So after we received the request, there was a special request actually for therapists that spoke Spanish, so bilingual therapists, and it was to go out to the shelters from the people that had been evacuated by the fires. And I was deployed to the shelter at Napa College. There was a couple shelters there, but I was assigned to a really big one, a shelter of probably a couple hundred people.
How quickly did you arrive once the fires started?
I believe it was the next weekend.
Okay.
Yeah, you can still see the smoke. You can still, smell it. So it was definitely right around the corner after it had all.
And by then, I'm sure the shelters were fairly full, if not
Yes.
to the brink of full.
They were full.
Yeah.
Yeah. So my job there was to assess and kind of just look over and see how I can be a help to people around there. There was a lot of people that were okay, but there was a lot of people that seemed that they were a little bit more distressed. So you would just kind of walk up to people and see how they were doing. I encountered a couple that was in 70s, 80s, and they were outside in their car in the parking lot because they slept there because their cat couldn't go in the shelter. So they decided to stay in their car with their cat. And so I was just checking in with them to see how they were doing, and they seemed to be doing okay.
So what is your goal in a situation like that? Is it just to be a listener? Is it to get them additional resources? What's your role?
Well, as a behavioral health specialist, professional, my goal was to have that lens and to see if there was anybody that was in crisis, and if there was, to respond to the crisis and see how we can be of help, and then kick it up a notch if we needed to, and assess that person as they needed to.
So Shruti, there was obviously of the 27 you had mentioned nurse practitioners, and there was also other firefighters, there was also public safety. Is that all being coordinated by the county, or are other local jurisdictions all operating on their own to provide mutual aid?
So it is actually coordinated by the county itself through the mutual aid response. We have a really good infrastructure in place to do that. And so the health system will go through the medical health branch of the county itself. And so it all funnels through the county system.
So when you are talking about the 27 individuals that were deployed up to the Napa and Sonoma County fires, and by the way, this could be anything that happens in Santa Ana or Santa Barbara or and Northern California. It's the same type of protocols. It's the same type of determinations that you go through. So do you, within the emergency preparedness, are you also deploying firefighters and police officers, or just mental health and behavioral health?
We are just deploying any
Health system.
health system resources and staffers. So the county Office of Emergency Services, they're the ones that are usually helping coordinate the law, fire, and sheltering aspects, other aspects that don't fall within the health system.
So when we have something that happens locally, let's say it happens to be an earthquake or a large car crash, how do then you assess something that's on local ground?
So the first and foremost, all the first responders would get there and they would provide feedback and information to the Office of Emergency Services, which is the entire county's emergency operations center. And then that would flow down to our health system, and we would actually help coordinate that response.
And then I imagine if you needed mutual aid from other counties, you can call upon mutual aid to have other counties come and help with behavioral health systems if you have too many people that you can't
I think
service.
it was great for us to be able to help in our neighboring counties and go out and see how we can be of help, because we might be in the same situation, and it's good for us to practice what it's like to be in a disaster zone. So I think it was really great for me to go there. What do you think, Shruti?
I think it was wonderful that we were able to provide not just staff, but also resources. We sent ambulances from the health system through our contractor. We also helped transport some of the medical caches from San Francisco.
Right.
So I think this is something we know we contributed.
Right. Well, Shruti and Betty, thank you so much for sharing with us about how San Mateo County prepares for its own emergency. And as I know now, it happens on a daily basis that we're practicing and preparing and setting protocols in place to ensure that we are ready. I thank you both for your service that you provided for our communities up in northern Sonoma and Napa counties. And thank you for sharing all of your good work with us today. We'll see all of you next time on Penn Voice.